Around 85% of the spine problems are associated with the weakness in muscles and not the bones. Our spinal column is made up of 33 individual bones stacked on top of each other. Ligaments and muscles connect the bones together to keep them aligned. The main function of our muscular system is movement, allowing us to stand upright, bend, and twist. The second function is maintenance of good posture and body position. But when muscles are weak and unable to support your back, the spinal column is forced to take the additional load, thus giving rise to back problems. MRI and X-rays are done to identify the problem. But MRI and X-rays are static images that tell us more about the bones, while in 85% of the cases, the problem lies in muscles. Hence, actual possibility of weakness in muscles is not revealed through MRI or X-ray. For precise treatment, it's essential to have an accurate diagnosis of muscles first. For that, there is digital spine analysis. DSA is India's first clinically accepted analysis for measuring the complete spine function. Digital spine analysis begins with a clinical assessment of the patient. An elaborate consultation of the spine is done by the doctors at Key Spine Clinic. A detailed pain history is studied along with a physical examination. Then, the DSA test is done on patented computer-controlled devices specially designed for treating spine disorders. Each DSA device is specialized for testing and treating different segments of the vertebral column. It is a safe test based on different diagnostic parameters like flexibility, strength, and balance of the muscular components with reference to age, weight, height, and gender. The muscles are first isolated using digital sensors on the device. There is a visual screen to monitor the recording of these digital sensors. DSA thus does accurate diagnosis that helps create a customized treatment program which reverses the root cause of the problem. With such accurate diagnosis, the doctor is able to test each of the muscles and analyze their strength and mobility. Thus, a composite functional profile of the spine is generated. This precise and comprehensive diagnosis of the deficiencies in muscles helps doctors identify the root cause of the back pain. Based on this, doctors devise a customized, patient-specific and problem-specific treatment protocols to restore the spine function.